Dear gentlemen, I think we should clarify the effect with QRS with other case studies. Mr. Professor Pelker, you have also brought radiographies? Yes, that's right. You know, at the moment I'm evaluating the results from a former internist in Bad Homburg, from Dr. Wolfram Haas. Meanwhile, he is in retirement, but he has treated as a local doctor more than 500 patients in 7 years with QRS. He has accompanied many of his patients for years. The development of the disease was clinically documented partly over years. I have brought 2 of his cases. With pleasure, please show us. Here I have brought at first 3 radiographies which describe the disease course of a shoulder joint calcification of a 43-year-old patient. When she began the therapy with QRS, she had already had for more than 4 years a regular odyssey with the most different conventional therapy methods behind her. The only alternative was an operation. Mr. Dr. Krapf, you as a doctor, can you shortly document the radiography for us? On the first radiography, we can see clearly the calcification of the shoulder joint before the treatment. Up at this white veil within the circle, that's the actual calcification. And when was the second picture taken? This picture was taken 2 months later. You see how a dramatic improvement has started with the regular application of QRS? The veil has almost disappeared. Also, the bone itself has a clearly better contour. This means that also there the irregular calcifications have been reduced. And here on the third picture, which was taken about 1 year after the first one, we can see how the finding has improved again. All depositions have disappeared. A really impressive example. You have brought another one, Professor Pelker? Yes, here I'll show you a picture of a, at the time, almost 70-year-old patient whose cartilage in the knee joint was worn. Here we see how bone rubs on bone. What does that mean for the patient, Dr. Krapf? The cartilage cleft is completely absent. Also, this patient must have had very strong pain. She must have been very restricted in walking. And after the QRS treatment? In the next picture, you can see clearly how the cleft has dilated again after the QRS treatment. It seems that a real cartilage substitute material has been formed. This means a real improvement for the patient. So one can say that the therapy successes with QRS have really been confirmed scientifically, didn't they, Mr. Professor Pelker? Yes, during my evaluation by Mr. Dr. Haas and by other specialists, I have seen many of those incredible reports, pictures and other documents. You know, I'm a statistician. Even if I include other statistical phenomena like spontaneous healings into my evaluation, the results are absolutely unambiguous. Thank you very much, Mr. Professor Pelker. I thank you.